Good day, everyone, and welcome to the New England Nursing Home Quality Care Collaborative conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Melissa Miranda. Please go ahead.
Thank you. Good morning, everyone, and thank you for joining us today as we introduce the New England Quality Innovation Network Quality Improvement Organization, formerly known as the QIO program, and to highlight the New England Nursing Home Quality Care Collaborative. My name is Melissa Miranda. I will be moderating today's session. I'm the regional lead for the New England Nursing Home Quality Care Collaborative. Before we get started, I'm going to quickly review a few housekeeping items. As Dana just mentioned, this webinar will be recorded and the presentation will be available within a few business days. I'll provide you with the details on accessing both at the end of this webinar. The phone lines will be on mute for the duration of the presentation. We ask that you do not put your phone line on hold during the webinar. We will be using the chat function to answer questions. If you have a question at any point throughout the presentation, please enter it in the chat panel to the right of your screen. I'm joined by my colleagues Alex Bronx and Lisa Crevier, who will be monitoring and responding to questions and comments in chat. We will also address questions through the phone line. At the end of the webinar, we will go through the questions and provide answers at that time. Last, if you find that the presentation is a little cut off, please use the plus or minus icons in the top right of the presentation window to adjust accordingly. Next slide. Today we will provide a brief introduction to the New England Nursing Home Quality Care Collaborative and the people working behind the scenes to make it successful. We will overview the elements of the QIN-QIO program and describe both the collaborative work itself and the overall approach. Next slide. We are excited to have a few guest speakers with us this morning. To start us off with opening remarks, I'm pleased to introduce Dr. William Taylor. Dr. Taylor is a physician in the Boston Regional Office of the Centers for Medicare and Medicaid Services. He is the Associate Regional Administrator and Director of the Division of Quality Improvement, where he is responsible for the Medicare Quality Improvement Program and for the End-Stage Renal Disease Network Program in 16 states. Good morning, Dr. Taylor.
Good morning. How is everyone? I've been asked to give some welcoming remarks, and first I want to say that in the Boston Regional Office, I work with 12 other people on quality improvement, and we work with the quality improvement organizations, now the QIN-QIOs, as well as the End-Stage Renal Disease Program networks. So I do want to welcome you to this New England Nursing Home Quality Care Collaborative. I learned earlier that the New England QIN-QIO has successfully recruited half of the nursing homes in New England, or 461 out of 943, which is quite impressive. For the nursing home staff, I want to thank you very much for your interest in working together to improve quality. And for the New England QIN-QIO, thank you very much for your success in recruiting your nursing homes. Next slide. Oh, okay, that's correct. I wanted to use this time to talk about different factors that could influence the healthcare system and how the nursing home actually fits in with the care they provide. So first of all, it's no surprise healthcare is changing, and all of us, whether providers, payers, or patients, have a real stake in understanding and learning and contributing to these changes. The first one is the healthcare system change. I will say that CMS, or the Centers for Medicare and Medicaid Services, has been a leader for the last 15 years in reporting and incentives that lead to value-based purchasing. And I'll talk more about that later. The Affordable Care Act is certainly a large change to the system, and most people really know it as the marketplaces and the exchanges and where people can buy health insurance when they're uninsured. But the Affordable Care Act goes beyond that, and I'd like to point out it mandated the creation of an innovation center that became part of CMS. And that innovation center has a budget of $10 billion over the next 10 years. And primarily they are involved in testing different models of care delivery and developing alternative pay systems. You may have heard of accountable care organizations. It's based on fee-for-service, but with a lot of incentives for efficiency and coordinated care. And currently, there are over 400 of these in the United States. Next slide, please. No, I'm sorry. Go back one slide. Thank you. I'll stay on this for all of the points. There have been 2 articles recently published. Medicare, as you may or may not know, is celebrating its 50th year, having been passed in 1965. And these 2 articles are in the New England Journal of Medicine, and I have them listed in a resource slide at the end of the talk. And I really recommend, if you're interested in Medicare, if you're interested in the future of healthcare, both of these articles are superb. They're written